Welcome to YARKUD International. Are you preparing for Saudi Prometric exam? So this section for you. We are going to discuss the recent Saudi Prometric exam question and answer. So today we are going to see the important surgical based question answer. So let's see one by one. First question. A female client is being prepared for surgery when the nurse asks the client to remove her wedding ring. The client refuses. Which of the following would be the most appropriate response by the nurse? Okay, most questions are, every questions are situational based only, and mostly they will ask what is the nursing responsibility? What is the nurse will do? What will be the priority care you will choose? Like that, the questions patterns will be. Okay. So in every video, we are going to see each type of questions with the answers. Okay. So here they are given the situation wedding ring is not removed. The patient is refusing to remove. Okay. But here they are going for the surgery. So preparing time, it's happening. Okay. Let's see the answers. Encourage the client to use soapy water to remove the ring if it is the type. Okay. First thing, what you have to do, if it is unwanted answer, it is not related, you should be removed. Then only you won't confuse with that. Okay. See here, they didn't give you that ring is tight. The client only, it is refusing to remove. But here they are just giving the option soapy water to remove the ring if it is tight. No, this option won't come. Okay, got the point? Second one, explain that the hospital cannot be responsible for jewelry owned during surgery. Okay, so this this answer also explain to hospital cannot be responsible for jewelry. We are not telling the patient to remove because it will be missed. It will be not like that. To prevent the infection only, we are telling the patient to remove it, right? So B also won't come. C, notify the surgeon office that the surgeon must see the client in the preoperative holding area. That is needed. Actually, the surgeon has to be see like that. If the surgeon tell, they will be okay. No, this answer also will be removed. Some question you can be take two wrong answer. Two will be there. In that, we have to choose the best one. But here you can remove three. Then what is the answer? It is D. Okay. Tape the ring in the place before the client is transported to the preoperative holding area. Okay. Just tape it off. Okay. That will be happen. And we have to be recorded in the chart. That will be the answer. Okay. Sometimes they will be writing recording in the chart. Yes, that is also the answer. Okay. Got the point? And you can report to the handing over nurse also. So these are the answer will come. Okay. Okay. Why I'm explaining this much? The thing is, all the promotory questions are situational, and if you just read carefully, you can able to answer. Okay. So the thing is, you have to be read the question properly, and you can easily choose the answers. Okay. So here the answer is D. Let's see the next question. The nurse is preparing a client for surgery. Prior to completion the skin preparation, the nurse assesses the surgical site for which of the following. Okay, so assessing, preparing for the skin preparation in the surgical site. So here they are asking nurse assessing the surgical site, which of the following. Okay, so here the options: presence of pustules and abrasion, presence of hair growth, presence of glango, absence of pulsation. Okay. So first, you have to be remember it is about the skin preparation. Okay. So no need to absence of pulsation. You are not going to check the pulse here. You're just inspection. Okay. You're looking the skin. So that answer you can be removed. D. Okay. And here the presence of lango. Lango is present in newborn babies only. We will be assessment will be there. So no need to come here. So presence of lango we can remove, and absence of hair growth. Actually, we will shave that area. So it will be absence of hair growth only. So no need to assess that, right? So B, C, D is the wrong answer. So what will be the correct answer? Presence of pustules and abrasion. So when you just inspect there is any skin changes, there is any pustules, any abrasion, okay, it will be looked for. So what is the option here? The answer is presence of pustules and abrasion. Okay, so if you read the question, you can easily, clearly, you can answer it up. Okay, so we have to be know the key point here. Skin preparation is the key point. Okay, let's see the next question. A client is admitted for the surgery. During preoperative assessment, the nurse learns the client is taking warfarin sodium. Okay, so it's otherwise called coumadin. Okay, when planning post-operative care for this client, the nurse would include monitoring for which of the following? This is the question. Okay. So what is the answer here? So we will see the option: delirium tremors, respiratory depression, bleeding or oozing at the surgical wound, and hypovolemia. Okay. So these are the options. So admitted for surgery. So pre-operatively, they are doing the assessment. The nurse knows the patient is taking warfarin sodium. So post-operatively, what is the care is needed? What will be mostly monitoring for this patient because of warfarin sodium? So what is the action of warfarin sodium? It will be the anticoagulant. Okay, if you know the action, you can easily answer. Anticoagulant to treat or prevent the clots in any veins or artery, lungs, or the heart. We will be treated with the warfarin. Okay, so this drug is giving. What is the main side effect? There is a bleeding because it is anticoagulant. So clotting will be prevented. So what is happening? There is easily bleeding will become. Okay, got the point? So here main side effect of warfarin sodium, it is bleeding. There is a direct answer is there here. Where is the answer? It is option C. Okay, see bleeding or oozing at the surgical wound. You can, some questions are directly they are giving. So bleeding or oozing at the surgical wound is the answer. Got the point? So let's see the next question. The post-surgical unit. Nurse is implementing measure to prevent thrombophlebitis. Which of the following is a priority action by the nurse? Okay. So option A, apply ordered anti-embolic stocking. Option B, reinforce the importance of smoking cessation. C is assess the leg with each set of vital signs, and D is teach the client to report human signs. Okay, so here you have to be remember the answer, understand the question first, then only you can choose the answer, because 4 answers correct only, you can have to do that all. But here post-surgical unit, what they are, they should be implement priority action. Okay, first action, priority action, what you will do? You will be just apply ordered anti-embolic stockings. Okay, got the point? Because why? We are just to prevent only reinforce importance of smoking cessation and all pre-operative we will be given. Okay, and no need to assess the leg with each vital sign. Okay, and D option, report the client to report human signs. No, the nurse should assess the human signs. Okay, so what will be the best answer? Priority action here, apply ordered anti-embolic stockings. Okay, got the point? Okay, let's see next one more surgical question. A patient is recovering from surgery using spinal anesthesia. The client developed a spinal headache. Which of the following nursing action would be the most appropriate? Okay, so here the key point, there is a spinal headache developed. Okay, so the there is a recovering from surgical using spinal anesthesia. That means post-operative period, there is a spinal headache there. So what will be the most appropriate? So see the options. A is elevate the head of the bed to 45 degree. B, keep the patient well hydrated. C, limit intake of salty food. D, elevate the head of the bed 30 degree. Which one will be the answer? Okay, if you know what is spinal headache treatment, you will be easily answer. What you will do? Have you remember that spinal anesthesia means it is like LP, lumbar site. Okay, so LP, if it is a patient complaint of headache after LP, what you will do? You will do the hydration. You just tell the patient to lie down without pillow, flat position, and you will just give the hydrate the patient with juices, water. Okay, that will be the management, right? So here also same. Keep the patient well hydrated. That is the answer. Okay. So answer is, it is B. Keep the patient well hydrated. So these are the main surgical questions. So if you read the question very carefully, you can easily answer all the questions. Okay. So here the YARKUD International, we are here to online training. We are providing for Prometric, SNP, MOH, THA, HAAD, OET, IELTS, and Omen Pearson View nursing examination. All nursing coaching will be available.